The mother standard of care is a beautiful concept. It is a value, a mission, an ethos that basically says in every decision, in everything that you do, think about what you would do for your mother or your father, your son or your daughter, your husband or your wife.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. We welcome the President and CEO of Cancer Treatment Centers of America, Dr. Pat Basu. Dr. Basu is a business leader and entrepreneur who has served as a senior executive to a variety of corporate, government, private equity, and clinical sectors. Pat, welcome to the Business of Healthcare podcast.
Pleasure to be here, Bob. Thanks for having me.
Well, it's really hard to find an area in healthcare business and leadership where you've not made a significant contribution. You've been a top executive at Optum, an entrepreneur, consultant in the field of telehealth and radiology, a former Stanford physician and White House advisor, and featured many times on major TV networks. So, Pat, tell us a little bit about your journey to the Cancer Treatment Centers of America.
Sure. I appreciate the kind introduction. And healthcare is such a vast and important field that I sometimes feel that even, the more things you've done, the more you realize that there's so much more to do. So in terms of my journey to Cancer Treatment Centers of America, it really begins and ends, frankly, with the overall notion that I've always professionally been driven by just fundamentally a really strong belief in this country and how do you make as large and positive an impact on the country as possible. And given my skill sets and my areas of knowledge, to me, that has really taken the shape of building a much better healthcare system, one that is significantly improved from where we are today, one that is safer and much higher quality, one that is much more accessible, and one that is more affordable and sustainable for the country and its citizens. So pretty much every stop along the way, Bob has tried to touch that. Now, as I go through these, they'll sound pretty different from each other, but I think they're all sort of unified by that. But as you mentioned, I'm a physician by background, board certified radiologist, used to be a doctor at Stanford. Always really impassioned around the idea of a large level impact. And that was one of the things that brought me to the White House. That idea that I could not say this if I did not have colleagues who helped one individual at a time. But my dream and my goal is to help 10 million or 100 million citizens or human beings at a time. And so that was one of the things that brought me to the White House. It further emphasized for me how important it is that we have people working on these solutions, and indeed how broken the American healthcare system is and why we need to fix it. Prior to CTCA, I led a few organizations, a large national radiology company. I then started a telehealth company called Doctor on Demand. And most recently, as you mentioned, at United Health Group, leading a large division that does a lot of value-based care. Through it all, up until CTCA, one of the things I think I've noticed is we need to bring the best solutions of what I call healthcare 1.0, which are all the traditional aspects of this system that I've learned as a doctor, that I've learned in practicing within the kind of four walls of the hospital, the clinic, so to speak. But we also need these 2.0 types of solutions, these cutting edge, transformative things. You're not going to solve old problems with old thinking. And so along the way, whether it be technology and digital health or value-based care, or data and precision medicine, I've tried to build a career that sort of draws on experience from healthcare 1.0 while deploying the solutions of kind of healthcare 2.0. And that's certainly what I hope to do here at Cancer Treatment Centers of America.
All right. Well, from a background looking at you with a mechanical engineering degree to start with, from the great university, the Illini. I'm a Purdue engineer myself, so I try to keep that in low focus. But
that's a great engineering school. Those are two great engineering schools and pretty good basketball programs too.
Yeah, exactly right. But from there, you went on to medical school and then to business school. So, and being a successful entrepreneur, I can kind of get where you're coming from, the driving mission that you're on, and not to underrate at all some of these past accomplishments, because this virtual health solution that you got involved with, Doctors on Demand, that was a whole new approach, I think, to trying to deal with things like urgent care and behavioral health and preventative health and chronic care. Can you share a little bit about what that journey was like as well?
I sure can. And I think it's worth mentioning because I do believe that some of your listeners are students, and I would just want to make a quick plug. Just getting to know you briefly, Bob, it sounds like you've got a similar background, but I'm a huge believer in multidisciplinary education, multidisciplinary training. So you mentioned my background as an engineer, in business and as a physician. I believe to solve complex problems in this day and age, we've picked a lot of low-hanging fruit off of the tree. So a lot of those siloed solutions, we've whittled down that stick as much as it can go. But boy, oh boy, I think you can really, really start to tackle some of these complex solutions and add value when you have a kind of interdisciplinary background where you can bring fields together. So if you can indulge me and forgive me for that public service, announcement there, for your students out there, that's what I would say. So with respect to virtual health, I think this is one of those really good examples of common technologies used in other sectors that can make a massive impact in American healthcare. So I think as I look at other sectors, we should be learning from them. So the airline industry, the transportation industry has put a lot of time into safety. We should always be studying and bringing the learnings from those industries into healthcare. Similarly, basic information technology, basic video conferencing has revolutionized just everything. And we need to be bringing those solutions into healthcare. So I was joking at a virtual healthcare conference. We had about 1,000 people in the audience. And I said, healthcare is the only industry where, you can help start a company that allows you to video connect with another member of the industry. And I'm going to get 1,000 people in the room to come listen to me. But jokes aside, it's revolutionary because most of the innovations in healthcare, Bob, have been on, I'm going to call it the Y-axis of building a better product or device. We have invented organs. We've created artificial organs. We've been able to discover amazing antibiotics and drugs. You can take existing technologies such as, email and video conferencing and things like that, and connect a patient to a doctor and really help reduce the access problem that we have in American healthcare. So, virtual health to me is an example where there are tens of millions of people who don't have access to care for geographic barriers. Right. And virtual health can absolutely, mitigate that problem very, very quickly.
Well, I was just thinking in this modern day today with that, the newfound coronavirus and all the people that are being affected, how that technology might have been an advantage to help detect, inform, educate, and react. So that technology is changing all the time. It's good to recognize that. As we look into the future, the things that we thought were always going to be done a certain way, that disruptive innovation starts to play a very strong hand in some of the change that takes place. At the same time, some of these complexities that we talk about, there's a quote that I want to refer to that you're quoted for saying, and I think it's powerful. I think it reflects a lot of your mission and your drive, and it probably plays very strongly into what you're doing at the Cancer Treatment Centers of America as well. But you're quoted as saying, "We do things in healthcare that take 59 steps and should take 5. We make things so overly complex that it leads to more cost and frustrations. So speak to that just for a moment, if you would, Pat.
Yeah, absolutely. Again, to build on that theme we talked about before, if you look at other industries, can you do things better, faster, and cheaper? Can you do things simpler and with greater safety and higher quality? In every other aspect of operations, in every other industry, those things are true. For some reason in healthcare, we have slipped into the mindset that more is better, or more steps or more people are intrinsically safer. Whereas every other aspect of modern human history has told us that simplicity leads to safety, and efficiency leads to higher quality. And so that's one of those areas in healthcare that I think is such an incredible, not just opportunity, but imperative for us to fix. We have in healthcare, in the entire healthcare industry, we have 16 administrators for every physician. We have processes and paperwork that drives doctors crazy, is incomprehensible to patients, and adds no value to anybody along that value chain, yet we force it. And the only thing that leads to is it leads to more errors. It leads to more frustration. And we have to simplify the processes in healthcare. We have to make them more efficient, and ultimately we have to reduce the variation. I always am a believer that variation is the enemy of quality, and one of the reasons, we can talk about this, that we have such poor quality overall in the American healthcare system is because we have such tremendous variation.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
Well, we always try to feature a fresh perspective on the business of healthcare with this podcast. And one of our most recent podcasts, it really had a discussion that talked about the healthcare industry, how it could be much better if it served society and focused more on health than just the business outcomes. And this high-touch approach kind of being the North Star to kind of keep us directed and focused on the patient experience and health outcome. And that really brings up a topic, I think, that might be germane at the Cancer Treatment Centers of America. And it's what you guys refer to as the mother standard. Please explain what the mother standard is and how important that is to what you do.
The mother standard of care is a beautiful concept. It is a value, a mission, an ethos that basically says in every decision, in everything that you do, think about what you would do for your mother or your father, your son or your daughter, your husband or your wife. And it really is a North Star, a guiding principle to exactly what you said. So, the other saying that we have at Cancer Treatment Centers of America is that it is only and always about the patient. So that, I think, is an important aspect for your listeners, because I think it's a leadership philosophy. And what I mean by that is, as leaders, we oftentimes want to make sure that our teammates are moving in the same direction. If you have 10,000 steps and 10,000 protocols and pages to read through and say, what should I do here? What should I do there? Look, you probably need that on a nuclear submarine, and there's times when you need that. But this is this guiding principle that says, do what you would do for your loved family member. And I think it's one of the reasons why our patient journey, our patient experience, our patient satisfaction have been off the charts. And that is something that I wish the entire healthcare system embodied would be that mother standard of care. Because if you think about it, in every aspect of healthcare, that's not true. Would you want your mother to wait in a line for 3 hours? Would you want your father to not get an appointment for the next 8 weeks? Would you want them to get a surprise bill that is incomprehensible to them, and even if it were, is totally detached from reality? Would you want your son or your daughter to get a hospital acquired infection or a medical induced error? Absolutely not, right? And that guiding principle is one that not only do I believe in it so strongly for Cancer Treatment Centers of America, I wish that was the guiding principle for American healthcare.
Well, I think when you get alignment like that, so obviously under one roof, you guys provide drugs, trials, precision medicine, things that you would expect in a treatment center, but to coordinate that with a philosophy where everyone is an expert in the coordinated care, I think it's a true differentiation, and it should be a goal and standard. And as we move forward with this healthcare industry, that element of what I would consider to be the patient experience or the customer experience, that's a differentiator. That makes people become raving fans, even in a situation where the situation is that of cancer and treatment. They speak highly of you and they feel like they are part of the solution along with you. I think that's probably a pretty powerful item to be under consideration.
It really is. And if I may, I'll go back to this sort of idea of two axes, right? You can be a provider and you can be excellent in fact, let me rephrase that. You can be a provider and you must be excellent at the surgery, the radiology, the chemotherapy, the drugs. Those have to be best in class always on that axis. But there are, unfortunately, and I know this because of the things I've done in healthcare, there are some places that might do that, but it leaves the patient experience totally out. The patient feels like a number. The patient feels that nobody knows why they're there, let alone even knows their name. Then, of course, there's other elements in healthcare that are good on that x-axis. They might know your name, they might be kind to you, but boy, they're not practicing good medicine. We, as an institution, as a society, as a healthcare system, we have to demand excellence in both of those. They are not mutually exclusive. You can absolutely walk somebody to their room, hold their hand, empathize with them, call them by their name, and then make sure you get the best, therapy that is possible. So, it is differentiating. And I think it's a big reason why we get so many patients who come to us referred by word of mouth because they've had such a care experience as opposed to the status quo where many healthcare experiences leave people saying, I don't want anybody to go through what I just had to go through there, let alone, a family member. So you're exactly right.
I try to encourage people if they would just think of three simple things: nutrition, rest, and activity. How do we get that back into our DNA? From the social determinants of healthcare, there are so many things out there that aren't really clinically related, but they are really on the personal side. And I know at your treatment centers today, you guys look at a holistic view. I mean, you look at all dimensions of the treatment, not just the clinical, but also, is it too far to say, a spiritual dimension of treatment as well?
Absolutely right. It's interesting. As you alluded to earlier, I trained as a mechanical engineer. I'm a board certified radiologist and physician. So I come from a very high tech world, but now more than ever have we realized the power of whole person care, holistic medicine, the medical determinants of health, the social determinants of health, the behavioral determinants of health, all need to go together. In fact, if you only focus on one, as much of the healthcare system is done, then you don't get nearly the progress or any progress, frankly, that you would get when you focus on all three. So to use Cancer Treatment Centers of America as an example, I see patients that tell me they would have quit their therapy had we not provided the emotional support services, the cancer coaching, the side effect, monitoring, the nurse providers, as well as some of the other things that you mentioned, the spiritual emotional wellness. People want to be treated as a human being, and cancer is as much of a disease of the mind as it is of the body. And if you don't keep up the patient's mental well-being, then they're not going to do well in their treatment. In addition to the fact that honestly, Bob, I think the reason our published outcomes are actually so good is not only because the right surgeries, the right radiation therapies, the right, chemotherapy or immunotherapy, but because we focus so much on improving the patient's symptoms and their well-being that they're much more likely to continue that fight and unlock the things in their immune system and their body and their emotions that can help them fight that. So in this case, they're related. And unfortunately, I have colleagues at other places that only focus on the former, not the latter. And that isn't going to cut it. It doesn't cut it in taking care of a cancer patient. I would argue it doesn't cut it in taking care of any sort of patient.
Excellent. I wanted to congratulate you and your team on how you represent this culture so vividly on your website. We'll obviously reference your website on the podcast, but there are some really great testimonials and demonstrations, if you will, of that holistic approach and how important that is to the overall service that you guys provide to your patients. That client experience or customer experience really is well represented, I think, in terms of the testimonies there.
Thank you. Thank you very much.
Well, Pat, we want to thank you for being part of the Business of Healthcare podcast. We're going to continue to follow you and stay in touch and really have been impressed with your leadership and your innovation and all that you're doing. I know you've been recognized by many different sources, many places, but from our perspective, that's exactly the type of leadership I think is going to make a difference going forward. So thank you for joining us today. We really appreciate it.
Bob, it's been an absolute pleasure. Truly, I thank you for having me on the show. Thank you for the kind comments and thank you for doing what you do. I think programs like yours are interesting, they're insightful, they're educational, and they really help move the dialogue and the needle towards a better healthcare system. So I'm very grateful for you having me on the show, and I hope we get a chance to connect again.
Very good. Thank you.
Take care.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.